So stomatitis, it is inflammation of oral mucosa. There are 6 types of stomatitis. The first one is traumatic stomatitis, aphthous stomatitis, candida stomatitis, Vincent's ulcerative stomatitis or Vincent's angina, nutritional stomatitis, and angular stomatitis. We'll see about each one of them with its causes and presentation. So the first one is traumatic stomatitis. Traumatic stomatitis may be caused due to dentures, teeth bite, harsh brushing of the teeth. That is mainly due to any trauma or injury. Traumatic stomatitis may be caused. And next one is the presentation. It presents as painful thin covering of a fur, and there is increased salivation. Due to an injury, there may be a formation of thin covering like a fur that is painful, and there is increased salivation. The next one is the aphthous stomatitis. The cause is due to malnutrition, steroid usage, or debility. So this is the cause for aphthous stomatitis. Presentation is aphthous stomatitis presents as multiple hyperemic painful vesicles. First it forms vesicles and later it develops into an ulcers. So multiple hyperemic painful vesicles is initially developed and later it develops as deep painful round ulcers. So first vesicles is formed and then progresses to ulcers. Next one is the candida stomatitis. The cause is due to candida albicans. It is fungal infection. It is mainly found in diabetic patients, patients who undergo steroid therapy, bedridden patients, etc. It presents first initially as multiple red spots that are painful in the tongue and buccal cavity. These multiple red spots later, in the later stages, transforms as curdy white patches. And further, it extends to pharynx and esophagus. When it extends to pharynx and esophagus, it causes dysphagia. So the cause is due to candida albicans, and it is common in diabetic patients, patients who undergo steroid therapy, and bedridden patients. It presents as multiple red spots that are painful in tongue and buccal cavity. Sometimes it may extend to pharynx and esophagus and causes dysphagia. These multiple red spots, in later stages, it develops into curdy white patches. So next one is the nutritional stomatitis. In vitamin B deficiency, the tongue presents as red areas with atrophy of papillae. In vitamin C deficiency, there is bleeding gums and loosening of teeth. And in iron deficiency anemia, as we all know, there is superficial glossitis. So next one is the angular stomatitis. Angular stomatitis is also called as chelosis. The cause is streptococcus or candida albicans, and presentation is angular stomatitis presents in the angle of mouth as red-brown fissures or ulcers, which is superficial, not deep. So the next one is Vincent's ulcerative stomatitis or Vincent's angina. Causative organism is two things, that is Borrelia vincenti or fusiformis, and it is common in adolescents less than 35 years of age, that is young adults. And presentation is it presents as fever and with excessive salivation, presence of red swollen gums, and these red swollen gums are covered with a yellow slough. This yellow slough coloration resembles a pseudo membrane, and these are painful. And from gums it spreads to cheek, palate, pharynx, etc. There are tender palpable neck lymph nodes, and musty fetor oris is present. If infection is present in tonsil or crypts, it is called as Vincent's angina, and this is confirmed by swab culture. So traumatic stomatitis, it is caused by injury to the oral mucosa. It is due to teeth bite, dentures, harsh brushing of the teeth, etc. and presents as painful thin covering of fur, and there is increased salivation. Aphthous stomatitis is caused due to malnutrition, steroid usage, and debility. Here, first vesicles is formed, which further develops as ulcers. Candida stomatitis is due to candida albicans, and it presents as multiple red spots in the tongue and buccal cavity. It may spread to pharynx and esophagus, causes dysphagia, and these multiple red spots may further develop into curdy white patches. Next is the nutritional stomatitis, may be due to vitamin B deficiency, vitamin C deficiency, or iron deficiency anemia. If vitamin B deficiency, it presents as red areas with atrophy of papillae. In vitamin C deficiency, it presents as bleeding gums and loosening of teeth. And in iron deficiency anemia, it causes superficial glossitis. Next is the angular stomatitis. Causes is streptococcus and candida albicans. It presents as red-brown fissures or ulcers, which is superficial. So next one is the Vincent's ulcerative stomatitis or Vincent's angina. It is caused by Borrelia vincenti or fusiformis, common in adolescents, that is young adults less than 35 years of age. Presence with fever, excessive salivation, red swollen gums, formation of pseudomembrane, that is formation of yellow slough, which are painful, and from gums it spreads to cheek, palate, pharynx, etc. And in neck there is tender palpable lymph nodes. musty fetor oris is present. If infection in tonsillar crypts is present, it is called as Vincent's angina. It is confirmed by swab culture.